Hello, this is Dr. Eric Potter from Sanctuary Functional Medicine, where we do our best to help patients live healthier, more abundant lives. This is our live Facebook session on cognitive health, how our brains work, mainly more for adults. This will bleed over a little bit into children's health, but mainly it's going to be more about adults. For those watching and for those watching later, just to be sure that you understand this is not direct medical advice. If you're not a patient of Sanctuary, we can't advise you and prescribe, order labs, or diagnose without a patient-physician relationship. So what we do want to do with this time is help patients understand their cognitive health more, help them understand how to care for themselves or potentially for a loved one. So what we're going to do is spending this time answering some questions. Now, this session we did not have as many questions. We did have one, but it's one of those days that I have not been able to find that question that was sent to me, and I'm hoping to get that. Or if you did send a question in, please go ahead and post it back down at the bottom of this, and we will try to get to it. So with that, we are going to be talking about cognitive health, how our brains function. So let's just do a little bit of introduction, just a little basic background about cognitive health. First of all, yes, our brains, most people know this, are where our cognitive functions occur. We use neurotransmitters, chemicals in our brains, we use electrical signals, we have cells that interact with each other, hold memories, cells that are communicating with each other through those electrical signals, and as they go from one to another, through those chemical signals. A lot of people know that there are a lot of medicines out there, whether it's for mood disorders, depression, anxiety, things that modulate, change the levels of those neurotransmitters, those chemicals. There's also a lot of chemicals out there, medications and natural therapies that we will talk more about in a moment. Therapies that change how much acetylcholine, serotonin, norepinephrine, those different neurotransmitters there are going from one brain cell to another, or how much are produced, how much are shared, how long they last. There's a lot of ways that we can modify those chemicals to help or also to hurt. You can cause damage. Sometimes if you're helping one thing, you end up hurting something else. So with that, a lot of what we talk about in cognitive health is going to be how we support your brain to work well in terms of electrical functioning, because your electrolytes affect that, your calcium, your sodium, your potassium, but also the neurochemicals. So you need building blocks for those neurotransmitters. So we're going to be walking through a little bit of some basic neurochemistry, brain chemistry, cognitive chemistry, however you want to label it, and building up to what natural therapies can help. So we do a lot of support, providing, addressing deficiencies, giving nutrients, giving minerals, giving amino acids that you need to build some of these chemicals. But then past that, there are things that get in the way. You need a certain amount of this, avoiding deficiencies, but then you need to limit your exposures to inflammation or toxicities. And those two things, toxins can cause inflammation, but you can have inflammation from things besides toxicities. So with that in mind, what we're going to try to do is lower any toxins. Those can be mercury, lead, aluminum. We're going to try to lower organic toxins like volatile organics, mold toxins, pesticides, things like that, and also more of the infection toxins. Really, that's a separate category, but infections, because they either directly interfere with brain function or they may cause inflammation. Inflammation then diverts energy and nutrients and building blocks for your brain function into other metabolic processes for the immune, fighting off your immune system, just like our military. People can have a debate over how much military we should have, but in our bodies we want enough military immune system that defends us from attackers. And if there's an attacker coming in, your body's going to divert a lot of attention, build up the Department of Immune Defense, and try to get the body to fight off something so it doesn't cause any more damage than it has to. And once that happens, there's a lot of things going on, and your body's trying to heal. So one of the reasons why that we feel sick, feel depressed, or even a little sad when we say have the flu is the fact that you're diverting a lot of things away from your neurochemistry that would normally help you feel better, and moving that into the repair or the defense, the attack and defend side of things. So we're going to rehash a little bit. We are going to help patients' deficiencies, what they need to do their basic functions. We're going to address toxicities. That may be in the form of chemicals, may be in the form of metals, may be in the form of infections. And we're going to address inflammation. So a lot of the latest research has been really exciting in the terms of the fact that inflammation is one of the things that's behind a lot of depression, anxiety, not just mood disorders, but then also behind Alzheimer's, behind some of the other neurodegenerative diseases, behind some of the effects of aging. So even if you don't develop Alzheimer's, inflammation can make your brain not work as well, just like when you have the flu. If you're inflamed, you are not using your chemicals, nutrients in ways that help your brain health. So with that little background, let's repeat back over that, and look at some of the ways that cognitive health can go in the wrong direction. So as we age, often our bodies are not absorbing things as well. Often we are exposed to more and more toxicities. Often we get busier, taking care of a lot of daily things, and we are eating less than healthy food, you might say, something you wouldn't call a low-inflammatory diet. Eating fast food, eating processed foods, just have that in time. You're rushing, you're eating more high glycemic foods, your inflammation is going up. So as we age and we are busier, taking less care of ourselves, exposed to more toxicities, having more deficiencies, we are at risk for our brains declining, but that is not necessary. We can, for the most part, have healthy brains, healthy cognitive function that continues longer into life, or also for loved ones. A lot of you may be caring for aging parents who are nearing that age where not remembering things as well. They're forgetting different things. They're forgetting names. They're losing track of some things. They're not able to keep up with checkbooks, or getting to the point where brain dysfunction is leading to family dysfunction, whether it's not being able to take care of, interact well in the family, and having to get help, assisted living, nursing homes, and so forth. So what we at Sanctuary want to do is help patients who are down the road, who are experiencing problems, and bring them back into optimizing their brain function. It may not always, if somebody's had 20 or 30 years of poor health because they've been eating poorly or toxins, we may not get them all the way back, but if we can get them back to the point that they're able to function for another 5, 10, or 15 years, that's a big thing for us and for the patients. But we also want to help those who are kind of feeling, my memory's not as sharp, I'm a little slower at work, not necessarily to the point of they're having to quit work or going to assisted living, but they're like, I want to prevent rather than waiting till they get to the point where they need a lot of help. So that's what we want to do, and that's what we're able to do in many cases. So let's talk about a little bit of cognitive health, places where we can intervene early, and then hopefully later towards the end we'll kind of do this on a chronological early, and then things that we can do to help cognitive health when it is already declined and bring it back. A lot of those things are going to overlap. It may be difference in dosages and timing and some of the disease processes we look for, but that's kind of how we'll approach things. So first of all, if you're not experiencing any cognitive health decline, or you are just early on in that process, what we want to do is look at your health at those same basic simple things: deficiencies, toxicities, infections, and inflammation. Those are going to be the biggest areas. So if somebody comes in, they're sitting across from us, we're going to go through a functional history that's very in-depth. For those of you who are our patients, you know that you're filling out a computer form that takes a good bit of time, but it gives us a lot of information. We've had a few patients say that you probably know more about me than some of my own family, because we're asking questions about growing up. Were you exposed to different chemicals? We have patients who've been exposed to major chemical spills, whether it's a military base, whether it's accidents. You know, we have the Flint, Michigan issues, but we've had those off and on in different places for a number of years. So with that, what we want to do is find out, okay, were you potentially exposed to X, Y, and Z? Do you live next to an Air Force base or an airport? Or were you, do you live next to DuPont Chemical, Eastman Kodak out in Northeast Tennessee? All those things where you might be exposed to something that could have a negative effect on any part of your health, in this case your cognitive health. Getting those history, walking through that, just the old-fashioned learning about you. And then what we're going to do is look in terms of deficiencies. We're going to look for, do you have enough B vitamins? Methyl B12. A lot of people know it as cyanocobalamin. It's what you will see, but really cyanocobalamin is not the best form of B12. Methyl hydroxy or adenosine are better forms that are better used by our bodies. With that, we want to make sure a patient has enough. Your nerve health needs that. Your methylation cycle, which your folate, your B12, your B6, your B1, B2, B3 are all a part of that, and some minerals as well. It's functioning to have healthy cell membranes. If your membranes of your nerve cells are stiff, if they're not good and flexible and fluid, you will not transmit signals along the cables of your nervous system as well, the nerves that run out, and you will find that it's either slower, doesn't pick up a signal as well. So we want deficiencies in terms of B vitamins. We also want to make sure that you have other healthy fats. If you do not have enough the right kind of fats, you have too many trans fats, your cell membranes get inflamed, they get stiffer. If you don't have enough omega-3s and 9s that mix in there, you do want a certain amount of cholesterol, so somebody could be on technically too low of a cholesterol diet. We want to make sure your nerve cells are healthy with all the things they need, the good fats, good vitamins, looking at minerals. You need the right balances of different minerals, whether it's calcium, magnesium, potassium, sodium. You can have too little or too much of each of those things. We want to make sure that your body has that. Most doctors are going to look and say, oh, well, as long as your calcium is in this range, it's fine. We don't see symptoms until you get to here. Well, actually, there's some milder symptoms that occur at those edges of what those normal ranges are that people wouldn't realize that, oh, yes, that calcium or that magnesium-calcium balance are off. Could be affecting brain function, nerve function. So a lot of those deficiencies. Now, that's more in the just the general nerve cell health. We also want to look at do your brain cells, do your nerve cells have the building blocks to make neurotransmitters? For example, serotonin. A lot of people know that serotonin is one of those brain chemicals that medicines like Prozac and Zoloft and all those raise up because they're allowing those chemicals to stay around longer. Well, serotonin's been around a lot longer than any of these medications have. What they do is they transmit signals, and the balance of how much of those, depending on, say, like a GABA versus serotonin versus norepinephrine versus epinephrine versus dopamine versus acetylcholine versus glutamate. The balance is, because you have some that are more excitatory, meaning kind of turning things up, and some that are more inhibitory, to slow things down. You want a good balance. Too much slow, too much fast, you're going to be potentially, or too fast, more glutamate, could have more anxiety, irritation, migraines, other symptoms. Too little of the good stuff, you may be depressed, or you may be anxious too with too little serotonin. what we're trying to do is making sure you have enough building blocks. Serotonin comes from tryptophan, amino acid, and proteins. GABA is an amino acid, but you can also interconvert that GABA, which calms you. You also can convert that to glutamine, which is one of the ways your body transports nitrogen around into your system, or glutamate, which a lot of people have heard of the term monosodium glutamate in terms of eating the spicy food, the Chinese buffet, or a lot of other foods we have, and getting headaches, migraines from that. So those interconvert, but you want to have good balances. Again, those are amino acids that are in protein. Tyrosine, phenylalanine and tyrosine are two amino acids that can ultimately be converted into dopamine and norepinephrine and epinephrine. All these are neurotransmitters. They're also things used out in your body to help with blood pressure control, help in the fight or flight response. If you need that adrenaline burst, that's epinephrine. You need to have tyrosine in sufficient quantities and the chemicals out there to make those out of those building blocks. So we want to make sure someone's diet is adequate in protein. An excessively low protein diet could be a problem. If someone is not digesting food well, if their GI tract is inflamed, severe dysbiosis, you may be eating plenty of protein but not getting it in. So sometimes we can actually treat somebody's brain function by improving their gut health, by giving them digestive enzymes to get more amino acids, which then allow them to have more building blocks for the neurotransmitters. So we're addressing deficiencies. We're also, minerals are a critical part. I don't think I mentioned that. Well, yes, I did. We already talked about that, but you need minerals for your brain to function. So we address those deficiencies for those patients coming in. We look at their diet. We have a nutrition intake with a holistic nutrition expert. What Kara will do is go through looking at the big categories, not just are you eating fats, proteins, and carbs, but are you covering the areas fiber, micronutrients, more the minerals and things like that. Are you getting enough healthy fats in your diet? She will start patients on an adjustment, adjusting their diet even before we see them, and then after we see them for the second visit where we've reviewed all their testing, then what we'll do is come back and have Kira see them again and give them kind of some nutrition plans, whether it's a detox plan, elimination food diet, a dysbiosis type diet, a yeast, anti-yeast diet. So we will address those things and help patients get their gut health to the point where it can support the brain health. Now, while we're on gut health, something I didn't mention is the fact that to some degree deficiency, toxicity, dysfunction, however you want to term, your gut and your brain also interact quite a bit. So this is overlapping in all these areas. So let's take a moment to talk about how gut health affects your brain health. Your gut has, some would argue, 1 trillion different bacteria in it, at least 3 to 5 pounds of bacteria that are down your colon. A little bit in your small intestine and stomach, but mainly in your colon. Those bacteria are useful, kind of like in a factory. There's a lot of different workers of those bacteria that either help make some vitamins, help break down food, help digest fiber, help make chemicals that you need for your body's proper functioning, and also they help interact with the immune system to keep your immune system primed to fight off other infections. It's part of the reason, the hygiene theory, that we have so many allergies and dysfunctional autoimmune issues is because we live too clean of a life and don't play in the dirt enough. So yes, you should probably let your kids play in the dirt a little bit more than you do. But back to cognitive health. So cognitive health is, and gut health is when that gut, you have more, say, bad bacteria. Well, let's start with the good bacteria aspect first. You don't have enough good bacteria. You may not be making all the chemicals you need, breaking down the food. So your brain may have some deficiencies, inadequacies, just because your gut dysbiosis or inflammation there is causing issues. Now, then you go back to the fact that that gut can let things in that cause problems. So when you have leaky gut, some of those same chemicals can contribute to leaky brain. So if you don't know what leaky gut is, normally your cells of your gut lining are nice and tight where nothing can get through. You don't see anything going through there. What happens with leaky gut is inflammation in order to let immune cells in, start spreading out those junctions between the cells. So you start having things that go in there. With that can be bacteria, it can be pieces of protein, different food, antigens that stirs up your immune system. It can also be something called lipopolysaccharide, LPS. So this is some part of the cell wall of bacteria that live in your gut that can trigger more inflammation. Now, those same things like zonulin, that can also cause you to have leaky brain. So just like your gut has this barrier, from your bloodstream to your brain there's a barrier so that things can't get into your brain. It's kind of a sacred place in terms of keeping away infections. Obviously you don't want viruses, bacteria to get in there. But when you have leaky gut, you often have leaky brain, and those chemicals get in easier when you don't want them to do. More inflammation, more other issues. With that, if you have bad chemicals getting in, they're going to go up through your bloodstream, and if your brain's also leaky, they can get into your brain, and you can have effects from that. Besides having the leaky gut, your bacteria in your gut also make chemicals. They can make serotonin. Now, your gut makes a lot of serotonin, but you have bacteria that can make norepinephrine, adrenaline, serotonin, some of the different neurotransmitters. You think, well, that's all the way down the gut. Well, you actually have more serotonin down in your gut than you do up in your brain. And with that, some of that serotonin can spill over. And again, if you have leaky brain, you can have some effects up there. So your gut health has another way through neurotransmitters it makes, either through the gut, bacteria causing you to make more serotonin or less of it, or through the bacteria triggering that themselves. And also, recent research shows that bacteria can affect your brain through the vagus nerve, which is one of the main nerves, automatic nerves that goes from your gut up to your brain. The bacteria can travel up that, or they send signals, and they interact with the nervous system that's sitting down your gut. So there's a lot of suspicion that things from multiple sclerosis, which is a degenerative brain disease, to Parkinson's disease may start down there, and that even Alzheimer's can have some effects from things that go on the gut. So with that, again, just kind of recap, we're looking deficiencies, nutrients, pure kind of aspect, whether you've got enough vitamins, minerals, good fats for your brain. Then we're looking at other things, your gut. We've taken a sidebar here, a side trail of the fact that your gut health can interact both with influencing what nutrients you have for your brain, and also allowing things in or sending signals that you don't want. So part of the reason why you're sick at your stomach when you're anxious is your brain and your gut are connected in many ways. So with that, we've talked about gut health for a little bit. Let's go on and talk more about toxicities. It's a good transition. Gut health letting in some toxicities, but also the fact that if you have heavy metals. So in the old days, although there's still a few out there, we get amalgam fillings in your teeth. I still have a couple in there. No, if you come to see me, I will not have everybody get the mercury out of their mouth, but if you have elevated levels and symptoms, yes, I will often recommend that to patients. But if you get those metals and they get into your brain, you will find that they will trigger inflammation. They often hinder proper functioning. They can cause buildup of different extra proteins. Lead can affect the brain both in kids and adults. Mercury, aluminum causes some inflammation. So if you've got leaky brain from a leaky gut, if you've got some metals that are floating and get into the brain easier, they're triggering more dysfunction and inflammation in the brain. There's going to be more chance that the cognitive function declines. In that, you also want an adequate nutrition. So back to the deficiencies for a moment, is you want to make sure that you've got adequate detox mechanisms. Meaning, if you have enough methylation cycle, you're going to do better about getting rid of mercury because it's methylated. Or you want to make sure you have enough methylation cycle to produce glutathione, because glutathione is used to detox so many different things, not just metals, but other toxins. You want to get adequate glycine. That's one of the sulfation, glucuronidation, glutathione conjugation, glycination, other things that are added to toxins to deactivate and mark them for exit, you want to make sure you have adequate nutrition that you can do those things. So from there, we want to make sure that you are avoiding toxins. So we will help patients look for the toxin sources. Tin and mercury often come from amalgam fillings. Some people, we have patients who work in different industries or hobbies, whether it's making jewelry with some metal that potentially has some chemicals in it, whether they are in an industry where there's a lot of fumes, metal fumes that are coming up. They do a lot of soldering, if they don't, welding, those kind of things can be other sources. Having a lot of vaccinations can increase your aluminum. Eating out of or drinking out of soft drink cans, aluminum cans, or aluminum food cans where there's acidic foods can pull out more metals. So we want to look if that's a possibility. Those toxicities, metals, are causing a problem. Then we look at a lot of volatile organic compounds. This may be your plastics, this may be some xylene solvents used in different industry, or it can be plastics that you're just eating out of the plastic wrap, cellophane, may be something you're cooking with, Tupperware, where some of those things can cause inflammation. They'll cause hormonal changes, which is another area we haven't necessarily mentioned before. With that, as we want to make sure those things are not getting into your body. Now, let's take a moment and just talk about toxins in our world. People are going to ask, well, how do you avoid toxins? To some degree, unless you're trying to live in a bubble, and even then you're in a plastic bubble, so you are exposed to that. There's the dust, there's what we inhale, there's what we ingest. It is hard to be completely free, but you can make some wise choices. So some of the things for cognitive health is making sure you're lowering toxin intake by using different types of containers to drink out of, different type of materials to cook with, so don't be cooking with plastic, but or in a microwave, use glass or stainless steel. Trying to limit your exposure to aluminum cans, trying to do different things that cut that down. It's going to be easier said than done. If you're out in a desert and all you have is a plastic water bottle, and you're like, well, I don't want to drink that water because it's in a hot water bottle. Well, you're going to die. So it would be better to have a little bit of plastic and boost your detox mechanisms later. But if you have a choice, you can go and have fill up your water bottle that you've got a stainless steel or a glass bottle instead of using a plastic. Try to make those decisions. Use things like a Berkey water filter or some other carbon-based water filters. Get out the fluoride. They can affect your health in different ways. All these different things are little ways that add up. Just like if you one step a day, every day, you're going to go miles over time. You're not going to fix all of these things at once, but if you can incorporate these into your lifestyle, you can have a healthier, more abundant life, healthier cognitive life for many more years than you would otherwise. So some of the volatile toxins, thinking about your work environment. Another organic toxin that's not something more, is less synthetic, except it's made by mold. Cognitive health can be greatly affected by mold toxicity. We have a huge number of patients who we are treating for mold toxicity, despite the fact that many in the conventional medical world would say, poo-poo, that does not exist. You can be allergic to it, but mold toxicity is not real. I've seen it. It's like, you might as well tell me that the sky is polka dotted purple and orange. I know it's not. I've seen blue skies. When I see a patient with mold, their tests show it, their symptoms fit with it, they find mold in their house, we get them out of that mold, we get the mold out of them, and they get better. You're not going to convince me after seeing that many, many times, even in my own family, that happened. So yeah, it's real. So I'm going to get off the soapbox there for a moment and just say that mold toxicity, if you're exposed to mold, 1 out of 4 people have trouble with it. 3 out of 4 probably aren't affected unless you're literally swimming in it. But about 1 out of 4 of the population, regardless of nationality, race, or country, aren't able to get rid of mold toxins out of their body. So a little bit can go a long way in making them sick. interfering in blood flow to the brain, causing inflammation, leading to even Alzheimer's over time, potentially contributing to other health issues, well, definitely contributing to health issues throughout your body. So with that, that's another toxin, like I said, mycotoxins, organic, synthetic toxins that we make, metals, mycotoxins, and then moving on to inflammation. So inflammation can come from toxins, it can come from infections. So patients can have chronic viral infections in the brain. There's recent research showing that one of the things that may trigger many Alzheimer's patients is human herpes virus 6, HHV6, or I think was it 7 or 9 was the other one. But some common childhood viruses that stick around in the brain, some people react differently to them, can cause a buildup to proteins that lead to degeneration, which then lead to poor cognitive health, Alzheimer's, and so forth. So there are some issues there with infections, but even just crossing over again with toxins is too high of a sugar in your diet, eating a lot of inflammatory foods, processed foods, artificial dyes and preservatives and colorings, which trigger inflammation. Inflammation opens up that blood-brain barrier where you get other junk in as well, but also it's diverting your brain away from doing the things it should be doing, so it makes it more likely to get an infection, it makes it more likely to not be able to heal, not fight off infections, so there's going to be dysfunction there. So we've walked through someone who's coming to us and we're trying to look for what is causing those early signs. So let's shift over a little bit. Before I shift over into looking at patients who are further down the road, or maybe their loved one bringing them in, we're going to talk about a lot of those same things, but looking at a question from Becky, gut neurotransmitters, cognitive health, all are interrelated. It seems most mainstream doctors don't have a grasp on these connections. Is this approach only taught in functional medicine? So partly due to the fact that research is just now coming out that will tell us, oh, inflammation is behind mood disorders or behind Alzheimer's, or just the researchers who discovered that human herpes virus 6 was behind a lot of patients with Alzheimer's. They really weren't looking for that. They were looking for something completely different. They were doing gene studies to see what genes were turned on, and when they looked, they realized, oh, it's viral genes. It's not human genes. So they started looking more and like, oh, these viruses are still active and potentially part of the mechanism. Now, could be secondary, but it's very suspicious that those viruses are contributing to the disease process. So there's a lot of this is research that's only been in the last 3, 5, 10 years. And you're like, well, 3, 5, 10 years, it seems like a long time. Well, in medical terms, there's a study several years ago that looked at it takes about 17 years from basic research, that's in a bench research in the lab somewhere, to filter out to the clinic where patients are actually using that. Doctors are applying that to their patients. So a lot of what we're seeing is something that just hasn't reached to the mainstream because it's got to get through the doctors who are learning it, then have to go back and be the teachers in the schools where they teach the next round of students who then go a layer. So it takes a while to incorporate these kind of things into mainstream medicine. So on the other hand, we are starting to see there's more recognition, whether it's neurologists using some anti-inflammatories, recognizing that omega-3s or CoQ10 can help brain function. There's nephrologists using alpha-lipoic acid for kidney health, endocrinologists using it for diabetes health and prevention. So there's a growing number, but there's still people, if they practice for 20, 30 years, if you're seeing, working an insurance model, which is the other issue, you're seeing 20, 30, sometimes 40 patients a day. You don't have time, you're just trying to pay the bills. You don't have time to go out and research, to read the latest research. You're kind of reading your textbooks, and that's, unless you're doing a board review to try to pass your boards every 7 to 10 years, or if you're grandfathered in, you may not have to. You aren't always looking at the latest, or if you're not going to a conference. Now, I'm not saying anything bad about those doctors. They're doing the best they can, but in functional medicine, we're really trying to stay on the cutting edge. I liken it also to the wave. We want to be on the edge of the wave where we're surfing. We don't want to follow with the front, try to do something before it's ready. We want to have research tested a little bit so we know it's actually helpful and safe for patients. But we don't want to wait on the back end of the wave and let the good surfing going ahead of us and missing out on the fact that we can help a lot of patients with things now instead of waiting till later. So it's growing. Hopefully we'll see more of this. I occasionally will have a patient come to me and say, oh, their specialist in whatever field recommended a low inflammatory diet, or recommended they eat more seafood to get more omega-3s, or recommended some different vitamins for different things. So it is growing, but it's going to be partly dependent on functional medicine, partly dependent on patients who challenge their doctors and ask questions. Challenge them nicely. Don't get your doctor mad at you or at me because, well, why did you ask that question? Well, Dr. Potter said so. Don't get me into trouble, but ask them, say, hey, here's some research. I was wondering, is this something that might be helpful for my symptom, whatever that may be? Or, if they're not receptive, yes, we functional medicine doctors here at Sanctuary and others are waiting around, and we're busy, but we're glad to have other patients come to us that we can help with those things. So let's shift over to kind of the question, is it too late? You have a loved one. They're 60, 70, 75, or 80. They're having dementia. They already have it, or they're starting to show that, and you're like, oh, they're forgetting, they're needing a lot more help and self-care, personality changes, their sleep patterns disrupted. So we're going to go through that functional approach, get the history physical, see their exposures, look for potential toxicities, deficiencies, problems in their diet, potential infections, gut health issues. Going to go through that same thing again. Then what we're going to do is look a little deeper, and this is, and we'll do some testing in the others, but we're going to definitely look at things that might indicate, oh, here is where this person's, with a person who's just starting to show early signs, we can do a lot of trial and error, trying different therapies and see how patients do. But for those who are already down the road much further into disease, ill health, poor cognitive health, we're going to push a little harder in looking for things. So we will do some different basic labs. We'll look at things like an HSCRP if you're inflamed. That's going to interfere with your body's functioning, inflammation marker, or a SED rate is another thing. We're going to make sure your liver and kidneys are functioning. If your main detox organs are not functioning, you're not going to have a healthy body or a healthy brain, either one. So we're going to look at that. Look at electrolytes out in your body. So just some standard metabolic panels. A lot of all regular doctors, conventional doctors can do that. But then we are also going to go a little further in doing some advanced testing. So we might do something called a NutriVal, or organic acid testing is a more general term for that, or an ion panel. What that looks at is organic acids, whether your body's functioning, not just how much this vitamin do you have, but more of a treadmill, a stress test for your body. Do you have enough of this vitamin to clear out this chemical? Because if this chemical builds up too much, you may have some negative effects. Kynurenic acid in your brain for inflammation, or FIGLU, formoaminoglutamic acid, being high means you don't have enough folates. So we want to see those organic acids being level, meaning you have enough vitamin, because your vitamin goes down, those go up. If your vitamin goes up, those typically go down, unless you have some other metabolic issue. One of the tricky things is, to make that go up and down, you may have 2, 3, 4 things, and it may be only one deficient causing that to go up, or it may be all of those. So we do a lot of tests. It's a broad panel, so we can really see, oh, is it your B12 that's low? Is it your folate? Is it your B2? We also look for things that are markers of yeast. Yeast can produce chemicals like aldehydes. So I don't know how many of you out here have had that experience, but aldehyde is what I would call one of the hangover chemicals. When you drink too much alcohol the night before and you wake up, have a headache, feel queasy, feel tired, you didn't sleep well, maybe have a headache, one of the things that can cause those symptoms are aldehydes. Your body's breaking down alcohol, on the way to getting rid of it, there's aldehydes build up. Those can make you feel pretty stinking sick. Yeast can make some of those same things like acetaldehyde, and a lot of patients who have a yeast overgrowth will find, oh, they have a hangover. They feel like they're always just kind of queasy, headache, don't feel good. So you can go a long way in treating some yeast in the gut with some different botanicals or pharmaceuticals, either one, to help patients feel better. Yeast also steal B1 and B2. So one of the reasons we find some patients are deficient in thiamine or riboflavin is the fact they have too many yeast in their gut that steals their vitamins. So we will work around that, kill the yeast, get your B vitamins up another way, and try to get you better. So we're treating, again, gut health. We're looking for doing organic acids. In that test, we will typically look for some heavy metals, the lead, the arsenic, mercury, tin, cadmium. Cadmium comes from smoking, being around secondhand, or smoking yourself, and some other industrial places. Arsenic, if you're eating too much rice, so somebody's eating rice, 2 or 3 products of rice a day on an ongoing basis, can build that up. So we look for those toxins, look for enough amino acids, looking for your balance of omega-3s and 6s. Those good fats, again, are measured by those tests. Then, based on history, we may look for chronic infections like Lyme. Can cause some degenerative changes. We look for mold toxins. We look if somebody has a history that they worked in a chemical plant or lived in an area where there's a chemical spill, or they spent a lot of time around the farm with a lot of pesticides. We will look for some of those with some different tests. Also, want to look at hormones. That's the other thing. If you're deficient in thyroid hormone or excess, too little or too much of cortisol can interfere with brain function. One of the reasons why under high stress your memory doesn't work as well is you can't form as many memories if your cortisol is elevated. Your hippocampus, where memories are stored, doesn't work as well. With that, we're going to look at hormones, look at testosterone, estrogen, progesterone, depending on male or female, making sure those are adequate. Hormonal health, we've talked about deficiencies, using those tests, looking at toxicities. We will look at inflammation with different markers. We put all that together, and we'll come back and put together a personalized program based on that. Now, someone may ask, hey, what about genetics? Well, we do look at genetics too. Apoe is a gene that if you have copies of the 4 allele, you may have increased risk. There's a few other ones, so we do look at patients' 23andMe or different genetic reports. But we can't necessarily change your genetics. Now, depending on what those are, we may say, oh, you're more prone to inflammation-induced Alzheimer's, or you're more prone to toxin-induced, or you're more prone to metabolic disorders like the high sugar that causes inflammation in the brain. And we will address those, but we can't fix your genetics. But we do use those to personalize programs and say, all right, let's wrap this around and put together a program that just for the person sitting in front of us. We also look at symptomatic therapy, so sometimes, well, most of the time, the things we do are going to take weeks to months to see full effects. So if somebody's having a lot of anxiety with their cognitive decline because they're anxious about it or having trouble remembering things, there are therapies like GABA, theanine, 5-HTP, magnesium, fish oils can have some benefit there. There's a lot of therapies we can use to ameliorate the symptoms as we're either doing detox, as we're boosting, addressing deficiencies, as we're detoxing chemicals, as we're treating infections, whether it's a chronic Epstein-Barr, chronic Lyme, chronic other tick-borne infections. We're addressing all those things both with the short term, get someone better as quick as possible, but in the long term, keeping them better and doing things that reverse root causes, not just throw symptoms treatment on there. So that is, we've been going on. Those of you know me know that I love this stuff, and I can talk about these kind of issues for hours at a time. But I wanted to give someone who is just looking at this for the first time, either for themselves or a loved one, a chance to kind of get a big picture of that. And that kind of puts most of what we do into about a 40 to 45 minute nutshell. I am open to some more questions. Again, this is not a forum that I can answer specific, what doc do I do with In fact, I can't remember where my keys are, or I have headaches and some memory problems. That you need a formal patient-physician relationship. But if you have just some educational topics about something that I just talked about, I am available for some questions. I'm going to think through some common questions I may get while I'm waiting, if any of you have any. But I'll give you that for a minute. And just as another side note, if any of you are interested in getting yourself or a loved one in, Stephen is our intake specialist, our patient relations specialist, who helps patients understand how our system works, and he is available at 615-815-5941 if you want to learn a little bit more about what Sanctuary does from the logistical standpoint. So with that, I know what else I didn't mention in there. We've talked about a lot of therapies, either deficiencies, toxicities, but lifestyle. Exercise, yes. Stronger muscles mean stronger brains. So there are hormonal chemical changes when you exercise that improve your brain health. It keeps blood flow, lowers inflammation, helps hormone balance, other chemicals that we're just now learning about that help your brain. Sweating also helps you detox some of the heavy metals and other things. So exercise. Now, that doesn't mean that if you've not exercised in 20 years, don't take my recommendation to exercise as, go out and try to walk or run 10 miles, give yourself a heart attack. This is something you want to do in conjunction with a doctor if new. If you're already doing it, great. You are benefiting your health, your cognitive and physical health. So exercise is one thing. Now, I say this with a grain of salt in the fact that I say, get good sleep. And some people say, well, the reason I'm seeing you is I can't sleep well. So we address those things, but don't let yourself choosing to stay up to 1 a.m. And trying to only get by on 5 or 6 hours of sleep a night because you're working so much be a reason why your brain's not functioning as well. Your cortisol is going up, interfering with hippocampal memory laying down, making sure you're doing that. So exercise, activity, sleep, the rest side of things, making sure there's a good mix, a balance of rest and exercise, rest and exertion. Dietary things we talked a little bit about, but trying to eat a low inflammatory diet, getting plenty of green leafy vegetables. And I want to share something with you that when I first heard, I was, no pun intended, but thought that was really corny in terms of your vegetable and fruit intake, was the fact that you want to have a good mix of colors in your diet of your fruits and vegetables. Each of those different colors have different phytonutrients, different antioxidants. So if you're eating some green, some purple, some red, some orange, some yellow, you're getting a good number of different colors in there. Those are actually more nutrients. And it's not just, I want a ton of this one nutrient, but you want a sum of all those nutrients to help your health. So rest, exercise, diet, and having a lifestyle where you try to limit stress. If there's relational issues, working through that with counseling or pastor or some other issue to lower stress. If you're doing things, you have a stressful life, is trying to de-stress. Now, say that with a grain of salt. Trying to run a business, raise a family, keep up with all these things is stressful. So we have to learn how to manage that to where we can tolerate it and prosper in that, which also gets back to spiritual health. That having a source of a spiritual foundation does help brain health in terms of lowering stress levels, having community where you're interacting with others, and good relationships. So we have another question here. Marilyn is asking about if you have Alzheimer's in your family and you're living a healthy lifestyle, should you be tested for the Apoe genes? I don't do that on everybody. Thank you for that question. I do have some patients who want to know if they have 3 or 4 family members, especially say if it's a family member that got the Alzheimer's in their 50s instead of their 60s or 70s. It's not illegitimate. To some degree, I'm going to tell you do a lot of the same things. Low inflammatory diet, address toxins, address deficiencies, address infections, address inflammation. I'm going to tell you to do the exact same thing. Now, some people, they're going to be better about sticking to that diet or those nutritional therapies if they knew that they have an APOE4. they say, yes, because I know this, I'm all in 100%. But if they say, oh, I have an APOE 3 or 2, which has average for 3 and low for 2 risk of Alzheimer's, they may say, I'm going to eat that cheeseburger and go through the fast food line and not quite worry as much about toxins. So to some degree, I'm going to tell you to do pretty similar to the same thing. The testing is one if you just want to know, or if you want to know that for your children, but then again, now you're revealing something they may not want to know. They may not really appreciate mom telling them, oh great, thanks mom, I've got the APOE 4. I really didn't want to know that until I needed to later on. But for knowledge, and if you need a little extra motivation, but I'm really going to tell everybody, low inflammatory diet, adequate nutrition, avoid toxins, address infections, address any symptoms earlier, lower inflammation. I'm going to tell you to do the same thing, so I wouldn't necessarily have everybody test unless you're doing that test for another reason. If we're trying to determine some genetic issues, if you're suffering from, we have Millie explain with organic acid or other testing, we may look at and say, hey, genetic testing may give more, and while we're at it, we'll see what your APOE status is. I've got time for at least one more question. Lance asked about having a family member suffering with dementia. PPA,
as opposed to testing.
Not sure what the PPA is, so if you want to leave that in there, I'm just trying to think off the top of my head. But as opposed to testing, what's the single most important test you'd recommend to begin a therapy to start improving the quality of life? So the simplest and easiest are going to be what I ended up with, is low inflammatory diet, some exercise, and managing stress. So those kind of things are going to be definitely huge factors in helping somebody. Now, if they're talking about, if they're like, hey, what pill or capsule can I take? Looking at if you're not going to do a balanced diet where you're getting those nutritional inputs in a diet, looking at a quality multivitamin, plus or minus a B complex, making sure you're getting enough B12 and folates. Beyond that, making sure you're getting enough healthy fats like the omega-3s, omega-9s, so you can get that in a supplement or in food form. Those would probably be the biggest things. Next step would be looking at getting your sugar checked to make sure your sugar and inflammation test checked, and addressing those if those are abnormal. So those would be the basics, and then we would walk through that longer functional approach. Those are the easy things I could say start without really being the doctor for that person. Those are 99% of the time, if not 100% of the time, are going to be the things you would start out with. So I probably have time for one last question. If anybody sticks it in there on Facebook, I can do that. So I'll give you a minute. All right, I don't see any more questions. If you're watching this later and you do have questions, you leave them. I do try to follow this up and answer some other questions offline if they're, again, educational questions. But thank you for watching. I hope this was helpful for you. Please feel to share with others if you feel like they need some insight into cognitive health issues for themselves or a loved one. And I look forward to our next, in 2 weeks. I forget what the topic is. Forgive me for that, for the rush of the day. But in 2 weeks, I believe, is when our next, I'm going to check the calendar here. Maybe 3 weeks. Actually, it's 3 weeks. No. Well, stay tuned so I can remember. Maybe I need to go deal with my cognitive health and remember when that next Facebook Live is. But we'll post it online and you'll be able to see that soon. Until then, give us a call if you want some more specific help, and we're looking forward to helping you or your loved ones live a healthier, more abundant life. So blessings and enjoy your weekend.